Welcome to Transform Gov. We're the digital government podcast where we share real life stories and insights from people who are actually out on the coalface delivering digital government in Ireland and also changing the face of how we access and deliver services. So as always, we've got the people, as I say, who are doing all the groundwork, and today's guest is one of those. Transform Gov, as you know, is part of the Ireland e-Government Awards, and it's brought to you in partnership with Accenture. I'm Maeve Kneafsey, and my guest today has one of the toughest jobs in the Irish healthcare system. She's probably laughing at me now, but it is a really tough job. Louise, or Lou, I'm going to call her Lou. Lou O'Hare is the Assistant National Director with the Sláintecare Transformation and Innovation Office and leads the Sláintecare Integration Innovation Fund. I think I've said that right. And in plain terms, Louise and her colleagues are trying to make sure that great ideas in healthcare don't die after pilot stage, become part of the everyday care system, and that we can all benefit from them. So her job is really to connect the dots, cut the red tape, make sure that when something works in one hospital or community, that we can all benefit from it right across the system. So not much to ask then, Louise. So you're very welcome.
Thank you. Thank you, Maeve.
Okay, so when we were chatting earlier, you said there was no shortage of innovation, and I totally believe that with my own past. But the real problem is joining things up so people know what's already working elsewhere. Is that the truth?
That is, yeah. There's fabulous innovation going on in the system, be it, in acutes or be it in community. It really doesn't matter. There's massive amount of innovation. The issue probably with us and why we're heavily criticised from a HSE perspective is that we don't join the dots, okay?
Yeah.
So the people who are living in Cork or the people who are working in Cork are running a project or they get funding for a project, but actually maybe the same project is running in Donegal or a version of, it may well not be the exact same, but a version of it will be running in Cork or will be running in Donegal, and we don't join the dots. There's nowhere to see that. There's no oversight. So, look, we have massive amounts of funds to run innovation and people can get money to run their innovations. The issue is, how do they see before starting it that it's been run elsewhere? How do they know that it's been run elsewhere? They can't. So realistically, the first bit about it is the oversight of it. And then there's probably a few different areas that, you'd need to address that we don't address. We don't address scaling very well. And that's what you said, Maeve, there. How do we get it from a project inception to scale? It's quite difficult.
Yeah.
And I think it's difficult for the innovators because they don't know where to go. They don't know where to get help. They don't know whose door to knock on.
Yeah.
So they'll get it so far and then it comes to a natural end because they can't bring it anywhere else.
I mean, I have experienced it from so many, people that have been involved with in tech startups in the healthcare system where they go, we always used to think, if you get a pilot, that's it, you're made. But actually, that's the beginning of it. It's only the very beginning. And the next stage is the really hard stage. So let's just talk about what the ambition is, what you're trying to do. I mean, I understand what you mean. You're trying to get beyond pilots. How do we have a flow? And how do you think you're going to be able to do that?
And I think it's not getting beyond pilots. I think the first thing is about putting a bit of structure around innovation in the HSE. Okay. And I think you have to start from the beginning. I think it's when they get the money for the pilot. Are we sure that they're getting the right money? Are we sure that they're being evaluated appropriately? Are we sure that they've been told if it's not working, you need to stop now? Are we sure that we're doing that? Okay. Are we sure that we have nationally, we'll say, an evaluation framework that everybody uses? Okay.
So in a way, it would be useful, I think, for you to tell people about the landscape as it is.
Yeah.
Because you've got things like Spark and then you've looked up, explain how people get in with an innovation.
So at the moment, they can come in through many different doors. They can come in through Spark, as you said, which is a fantastic kind of fund and a fantastic avenue for people to start up. Then we have Research Ireland grants, we have HI grants, we have, there's a huge amount of grants out there, a huge amount of funding. It's just that, again, we're back to the same problem. The innovators apply for the funding. There's they get the funding, but there's no oversight of that funding once they've got it. Who brings them forward? So if you get money from Spark, they'll follow you for the year that you get the money, and then it's up to you, the innovator, to try and get that secured in your region or in your hospital or in your community. And that's really difficult because the innovators do not know where to go.
Of course they don't.
No,
they're not
they
not
really
system
don't.
experts.
No, they're not.
Yeah.
They're not. And that's where we come in. And I suppose that's the ecosystem at the moment. That's what it looks like.
Okay.
What we're trying to do in our department, or as a collectively, and I think everybody appreciates it. Spark appreciate it. High appreciate the problems. We all appreciate that there's issues. The thing now is, how do we put some governance, and how do we put some guardrails, and how do we put some structure around it, and how do we give the people on the ground a book to open and say, all right, I've got this, now I go here, and there's a pathway.
Yeah.
There's no pathway.
Yeah. And of course, the other thing is, sorry, when you say the word governance,
Yeah.
innovators immediately go, because...
No,
But in fact, I think it's because the governance goalpost can change.
Yes.
So are you trying to say, look, once we're going to have a centralised governance that's acceptable to all hospitals, we don't have to go back to the beginning again.
Yes.
Explain that a little bit. I mean, what the
so
framework might contain.
the framework will contain, it'll have a steering group. And that's probably the overall governance. So if you apply and you get money to run whatever, they'll come in through the framework, okay? We'll have some oversight on it, or nationally there will be some oversight on it. And then it will be monitored, it will be evaluated, and the evaluations will go through the steering group. That's all. It's not the governance of the funds. So people get a little bit kind of, the people who work for Spark, or the people who work for High, or the people, all of those that have their funds, they don't want to let go of their funds, and we're not looking for their funds. We're just looking to bring the governance bigger, okay? We're looking to bring it outside of that and say, right, this is really good, but we only need to regionalise this. We don't need this everywhere in Ireland. You've done really well. It's fantastic. You've met your milestones. You've done what you said you were going to do. And we think you should continue. And this is the route you need to go to continue. But actually, do we need that everywhere in Ireland? Probably not, because it's niche. And it's maybe you and, I don't know, a hospital in Tipperary that need it. But for those bigger projects, it is about saying, well, right, they've proved a concept, but I'd like to actually make that a little bit bigger. So that's where SIF comes in. That's where the Sláintecare Integrated Fund comes in.
You refer to as SIF.
Yes.
Okay.
So what really should happen is you get we'll say, if you're the innovator on the ground, you want to bring in something, you'll get a grant or a research fund to set it up, to prove a concept. Then you'll run a pilot from that if the concept is proved. So you'll get the research around, you'll then go to Spark, and this is the pathway you'd like everyone to go. And Spark will work with you for a year. They'll give you the money to prove the concept. Okay, and then you go into SIF, okay, and SIF will give you the bigger money where we can regionalise it. So we can expand it and, see does it work on a bigger scale. And then after that, it's about scaling. So I came into this about 3 or 4 years ago, and I suppose we all know the problems, but how do we fix them? And there's a project that I ran in SIF. Well, not me personally, but the department. We work with the department to run these. And I suppose I saw the merit in it, and I saw, how we could actually use this to scale something. It started as a research grant, very small in Galway. It proved a concept. It then got SIF funding. And then it's now going to be scaled. So we're now scaling it nationally.
And what is
it? So that's how it's called the Healthy Islands project.
Okay.
So
is this when you started in Ishboffin? I remember you mentioned that to me.
Yeah.
So tell us about that. That's a lovely example.
Oh, it's a fabulous example, and it's worked. And it's worked by, I suppose,
because people don't know what it is.
Yeah. So it is the research group in Galway. So it is a shared project between HSE and academia, which is fantastic. There's a big win, because we always want to have our academic partners. It's not just all about HSE. So the Hive Group, they're a research group that work for Galway University, but are headed. Their leader is a consultant called Derek O'Keefe, and he works 50% for the HSE and 50% for the university. So they have a research kind of unit within the hospital. So they set up, they wanted to prove a concept on Clare Island. Two of the researchers are from Clare Island, which is really great. And they saw that why should, when they live on an island, how come they can't access care? So Sláintecare is all about, the right care, the right place at the right time. So how come they couldn't access it? They had connectivity issues. The people had to leave the island to go to Galway Hospital, which is a day, 2 days, with the best will in the world.
Yeah, and all the cost of staying over.
And the cost of that.
Stress.
And look at our demographics. Look at also our age population. Really aging. So we're talking about 60, 80, 90-year-olds having to travel, get on a boat from Clare Island to Runapier if the weather was good, if they were lucky. Then travel from Runapier to Galway for their outpatients appointment and travel the whole way back. So you're talking 2 days out of their whole life. And they do need to do this if they have a long-term illness, they're doing this once a month at least. So hugely, hugely time consuming, and value for the patient, none. Value for the system, probably none either, because if the weather was bad, they lost outpatients. So there was huge issues with this. So they started the project, got money to prove that if they brought in and integrated some telehealth. And it's all about, there's 3 concepts to it. The first one is remote monitoring. The second one is access to telehealth.
So basically talking to a doctor or an expert,
yes,
whatever.
Absolutely.
Online.
Yeah. And the third piece of it is health promotion. So 3 great strands. And they brought that in through the SIF project. Okay, so SIF funded, gave them, I don't know, maybe... I think they got about just under $1 million to do it over 2 years, and they proved the concept. So they proved that they could get telehealth onto the island, and now a lot of their patients on the island or islanders can access care either from an outpatient's perspective or from a community perspective. So they can actually get their assessments by community over these devices that they have put in. And they also now have health promotion. So it's all about, looking after yourself.
Yeah,
it all
prevention.
falls into, and it all falls in under Sláintecare, the banner of Sláintecare.
Okay.
So once that proved its concept and met its milestones, and it was evaluated at every stage from a SIF perspective, because it's very rigorous, 2-year process. That and it was deemed to be exceedingly valuable and beneficial for islanders. So then why would we not roll that out to all other islands?
So you're trying to create a framework that basically enabled something like that, which you've proved it's wonderful. There's funding gone into from the state, and it's proved a really good concept that it actually can be rolled out where appropriate.
Absolutely.
Nationwide. But there's another piece, isn't there, as well? The other piece is that people don't even know what's going on. So are you a window into all of the different pilots, let's call them, or innovations that are happening? Yeah.
So the other part of the framework is the repository. So we've gone out to each and every stakeholder and ask them. So that doesn't mean the funding stakeholders, it means the hospitals, it means the communities, it means innovators, and ask them, what are you running in your hospital? What have you got up and running that you've got money for, that that's innovative? And we're setting up a repository, and everybody, each region will have access to that repository. So if you want to, put in some telemedicine or some digital enablement, maybe for pancreatic patients, or you develop a pathway for particular patients. You can look and see, has it been done elsewhere in the country?
So interesting, because we had a woman on, Anne Kiernan, who's from Limerick University Hospital. She was talking about a solution she's worked on where there's pain management, which is done through VR. distraction in a way. And I'm only going to do a bad job in terms of how clever and brilliant it is. But it's brilliant at pain management. And of course, that's so many applications, and this little pocket of excellence.
Now,
It sounds like you know her.
No, but I'm going to tell you that that's running in Tala as well.
Very good. Excellent.
So there is that lady in Limerick who does not know that it is running in Tala because they are completely different health regions.
Okay.
And it is running really well in Tala for the pain, pain management.
You learn loads from each other as well in terms of collaboration.
Absolutely. And they have the VR headset. It's fantastic. And only that I was out in Tala. So it is about, and I suppose that brings us back to the islands thing. Like, people shouldn't have to knock on my door or find out who I am to be able to say, how do I get something done, Lou? How do I get this scaled? This isn't the way it should be.
And it's funny because I think people think that the way these things work, is that there's a whole load of innovators knocking on the door of the HSE. Well, of course, there's an element of that. But in my experience now, they're going, better off going to the States, the UK. It'll never get through this HSE system.
No,
so you're losing stuff. And then the other side, actually, the clinicians themselves love technology where it helps them with what they're doing. And I think there's completely, people don't realise that.
Yeah.
So where does the pressure come from? Are the clinicians kind of banging down the door saying, well, I want to know what's going on. We're trying to find ways to solve problems?
Everybody is. Okay. So they have an access. So they have, so the clinicians now have a fund that's run by Spark. It's called POC. It's the public only contract, and that's their innovation fund. And actually, they're using it very well, and Spark run it very well. To be fair, they're actually pooling. So a lot of consultants, you're right in what you say. They're all innovators. Okay, they want to do better, so they're pooling their fund. They get a fund per year as part of their contract, and they're pooling that to bring in these things. But the issue is that I suppose we're back to the governance again. Yeah. We're back to how are you getting it in the door? Are you using compliant procurement processes? Are you ticking all the boxes? I know I sometimes people say, oh God, Lou, you can be very negative at times. But I'm not negative. I'm just highlighting where our problems are in the system. They're not negative.
Yes.
It's for us to turn them into a positive. Yeah. They are real and they are there. And I know people don't like to talk about them a lot, but they're there. And unfortunately, that's my job. I have to say, well, look, we need to put some guardrails around this. I don't want to own it. I just want to make sure that everybody's doing the right thing and we're compliant. And
if they get through, let's say that oversight and that governance is we've ticked the box, okay, for the pilot.
Yeah.
Then it's done, right? So in theory, when you start to roll it out maybe to larger numbers,
it's so easy.
It's much easier.
It's much easier. So if the consultants go off and they do, and it's great, and they get their money, and they buy a piece of equipment, we'll say, because it's going to do something, it's going to be really valuable for the patient. They're going to get something done really quickly, much more efficiently. And I absolutely see the merit in that. But it's after that. How do we maintain it after they got the money? How do we know that it's come in through procurement, it's being procured appropriately? And if I want to use it in Cork, how can I use it in Cork if you haven't done all of that? I can't. So actually, you're nearly putting a barrier up before you go and you get your money. Because there's nothing we can do with it. We can only deal with it when we get it, and we can only manage it. But who's going to manage it after that? So there's an awful lot of strands to innovation.
And when you imagine kind of the framework, how do you think people will engage with it? What'll it look like? Okay,
so literally the framework is probably, and when we talk about this, people go, oh, here we go, another strategy, here we go, another 90-page document. This is 10 pages.
Okay.
It clearly outlines there's 10 things within it that we want to implement that will put some structure nationally. And I think I didn't go away and just write it myself. This is not my document.
Okay. Before we get into those 10 things, which you do want to know, I have to take a very short break.
Yeah.
Because we've got to thank important people. That's our partner Accenture. And we'll be back to you with Lou in about 2 minutes.
Through the power of cloud, data and AI, Accenture is helping the public sector by blending human ingenuity, technology and a delivery-focused culture to turn their ambitions into action. Be ready for any challenge by adopting a continuous reinvention mindset to deliver human-centric services that adapt and grow with your needs. Contact the team at Accenture to find out more.
So we're back after our short break, and I'm talking to Lou O'Hare, and she's telling us all about the SIF framework, which she's going to explain now for me. What will it contain and what will it look like? That's going to help innovation really be rolled out beyond pilots, if you like, within the HSE.
Yeah, so it's probably we've kind of touched on quite a bit of it in our conversation, but the framework for health innovation, it highlights the current issues, and then it gives you a solution to those. So the first one is the steering group. That's the first thing that we want to bring in. The second one is that we want to have innovation pathways. They're not all going to be the same, and they're not, but as long as they're all aligned, it doesn't matter. There's idiosyncrasies everywhere. So, but as long as we're all singing to a hymn sheet and not different ones, we're doing well. The third one will be there'll be an evaluation framework as well. Will that be the same for everything? No, but there will be key metrics, and there will be there'll be a start, a middle and an end to all evaluation projects. So again, as I said earlier, if you go in, you want to run something, you'll pick it up and you'll see, where do I go to get the money? How do I run it? How will it be run? And if it's good, how will we scale it? Then there'll be a central repository. That's what we're looking to do. That's what we talked about. We'll have oversight. There'll be oversight. I say we as everybody, we as the system. Okay, there will be oversight because we're trying to get away from the national piece, and we're now in regions. So it's all the reform. So we, being the 6 health regions, will have oversight. And it's not that, centrally there'll be this person like me. I'm just the go-to person. I'm just the helper. I'm not the innovator.
The facilitator.
I am the
facilitator.
facilitator.
The facilitator.
I am, and I'm the go-to person when you need to know something.
So if I'm okay, let's go to the existing world. Okay,
yeah.
And let's say I'm a consultant and I have a problem.
Yeah.
Or I could be, a head nurse, whatever, of a department. Anyway, I've got a problem, and if somebody comes along, or I found out about technology, I know is going to solve that problem. Let's say it's drug victim rehabilitation, okay, and they can do it through VR, because we did interview somebody about that. At the moment, I might approach somebody and say, can you help me with this? I might meet them at some event, a Spark event, and then we collaborate together. We come up with a framework and some sort of pilot, and then off we go. But it's contained within that group of people, am I right? It could be my hospital, let's call it Maeve's hospital.
Yes.
But are you saying that that's not going to happen that way anymore? It's got to be, that'll still go on.
It'll still go on. We're not going to stop any of that. It's just that they will apply, or they will let us know through the repository that is what's going on. There will be, and they will be expected to hit the milestones. Okay, it'll be followed, and it'll be, they'll have an evaluation framework. They'll have what do they need? Is it valuable? Is it going to add value to the patient? Is it going to add value to the hospital? What is it adding value to? And is it worth the money? That's the first piece of it. Then secondly, go ahead, do it. But what it will do is say, right, you've met your milestones, you've proved the concept. Now this is how you go about getting it scaled or getting it regionalised, or whatever you want to do with that. Where it will be that kind of backbone of what you are doing. It'll also look at your procurement. Okay, it'll make sure that you're compliant. So you won't get up off the ground unless you're compliant. And unfortunately, we fall down there. Look, and I 100% get it. Believe me, I get it, because we don't have quick, easy procurement pathways.
And would you be able to relook at those pathways so that they're...
that's part of the framework.
More efficient.
That's one of the 10 points in it. So I work quite closely with procurement, and we're currently trying to look at different models in other countries, because there are other models that are really good, and we're going to try and adopt some of those. But Rome wasn't built in a day. You have to start somewhere.
Yeah.
But it's at least if you're compliant at the moment, we're not in a situation that, number one, the innovator can't go any further with it, or number two, we as an organisation have to say, no, I'm really sorry, you have to stop because you're not compliant.
Okay.
Whether it's added value or not, you can't continue.
Because procurement can be a blocker, can't it?
Yes, it's very difficult.
Do you think that's a technology problem? Do you think that's the way we think? What do you think?
I think for many years we got used to just doing what we done. Okay, we've
always done it this way.
Yeah. I think COVID gave us. I think COVID was a great thing, but it was a dreadful thing at the same time. Okay, but from a HSE perspective, most definitely we got to do things very differently, and we didn't have to think about it. We didn't have to procrastinate about it. We had to do it, and that was it.
Yeah.
Okay. Now, that came with a health warning as well, okay? I have to be very honest, because some things were brought in minus the governance side of it, minus the right procurement, and we're just trying to sort all of that out at the moment. But we, as an organisation, saw that we could do things a lot more efficiently and a lot more speedily, and things didn't have to take such a long time, okay? And I think procurement, to be fair, yeah, they are behind, but they are 100% appreciate that they need to change how they're doing their things. They need to change their approach, and they are actually looking now. So they're very invested in the framework. They were part of my stakeholder group. So I was when I went out to write the framework or to pull the framework together, we brought all the key stakeholders. So from an industry perspective, from an academia perspective, from procurement, and all our kind of acutes community, clinical, we got all the big stakeholders in to write it. I didn't write it.
Yeah.
They wrote it, to be fair. This is their framework.
And in terms of procurement, and I know that's the only way to work, by the way, having all your stakeholders there. Are there other countries that are really handling this better, and can we learn from them?
I would say France are, and we've done quite a lot of scoping with France, and we have an MOU with at the moment with Sláintecare Ireland, so we kind of use those. So we're working with Sláintecare Ireland in order to help us to look at speedier ways to do it. And I know procurement are working, there's a procurement pathway in that MOU, and they're working together to do that. And so I think we will get there.
Yeah. I suppose the thing is, like all things, people are saying, when?
No, I know. But that's like everything, isn't it? But I think we can't hit ourselves over the head with a stick anymore, okay? We've been heavily criticised from a HSE perspective, but actually we are doing something about it. Oh, yes, I'm not saying it's, fast, but we are trying, and it has to be done right. So you can't bring, like, COVID, as I said to you, was a great thing and it was brilliant. We brought stuff in, but was it done right, all of it? No. So I probably would go back, because I'm after spending a year trying to clean up some of the stuff, and it was quite difficult and, very contentious. So if I was probably doing it, if I was there at that time, albeit that I wouldn't have had the ability to say, no, you can't do this, because we needed it and that was it. You have to deal with it afterwards. But no, Rome wasn't built in a day. We have to start somewhere.
Yeah, absolutely.
And we didn't have a framework.
The fact that we're doing this is important.
Yes.
And look, the fact is that procurement, you can do it really well.
You can.
Without missing the steps.
You can.
It's just, I suppose, I'm interested in how others have done it. Is it because they've used technology in a certain way? Or do they have very kind of SLAs where they say you have to have that done by such and such so many days?
Yeah,
so it's a mix of different ways of approaching things.
Yeah, they do.
Yeah. So there's nothing we can't do then.
No. There's absolutely nothing we can do. Yeah. We can't do. We are tackling it. We are, and there is they are signed up 100%. The will is there, and I think it is about momentum. And it is about those people just trying to push. And that's my job.
That's your job.
That is my job.
That's what I meant. The hardest job in Irish healthcare.
No, it is. Yeah, because sometimes I'm deemed as, people say, oh God, she's great, she's after doing this and she got us this. But other times it's like, oh my God, she's kind of depressing because she has all the bad things to say.
Yeah.
But I don't...
do it properly, we move faster at the end of the day, slow and then fast. But I think the fact that we'll have a repository which everybody can look into and say, I'm not assuming anything, but I would think the Gen AI could be amazing, where you said, okay, these are my problems. Is there any pilots going on? And then it would very quickly bring to the top what's relevant to you.
Yes.
And that could be massive.
Yeah.
Just the fact that they're there and then to be able to kind of interrogate them.
Yeah.
Because, as you say, it can be depressing when you're in an organisation as an outsider. And I know there's a couple of pilots going on that are the same thing, which is a terrible waste of resources. Because even if the pilots were separate and similar, collaborating around the findings would be hugely beneficial.
Absolutely. And, we do have... Look, it's just the environment, the ecosystem we were in. There has been a lot of money and duplication, given into duplicate projects. Unfortunately, that's just the way it is. And I'm not saying that we have the answer to everything, okay? And I'm not saying that it won't happen again. But what I am saying is it won't happen to the extent.
Okay. So look, tell me about your timeline. What are you looking at? What are you working towards?
Okay, so... I've spoke a lot about the framework, but the framework that's just the document, okay? It's the implementation of the 10 pieces that make up this framework, really. I'm ever the optimist. I know I don't sound it a lot of the time, but my glass is always half full. So I'd like to think that we could, number one, have the bones of all 10 in place by the end of 26. Like, the steering group, we near enough have it, okay? The repository, we're already gathering it. We just need somebody, I work with technology and transformation, which is great. I work under the banner of technology and transformation, so I have a lot of bodies that are willing to build the right thing. And, we'll use that and it'll be done very quickly. I think the bones of all of this is there. I'd like to think that using my Islands project, that was simple to do, okay? I don't mean that I say that tongue in cheek a little bit. It wasn't simple for them because they had to bang on the right door, unfortunately. And, it's really hard as an innovator. Who do you go to, sort of thing? And only that I fell over it and fell upon it, that they got to where they are now. But that could be so simple.
Yes.
If people would I need people to trust in the framework.
Yes.
I need them to trust. I need the innovators and the stakeholders to trust in it. And that's why it's co-designed, really.
Yes. And people like Tom Laffin then, the Chief Data and Analytics Officer for the HSE, which is our first, isn't it, in that role?
Yeah.
I presume he and you must collaborate a lot.
All the time.
And he's trying to use data, really, to make good decision-making.
Yeah.
So in a way, they're hand-in-hand, innovation and data, and then trying to consolidate those into a kind of a cross view of the HSE and what's possible.
And it's funny you mentioned, Tom. Myself and Tom are setting up an innovation hub, an AI innovation hub or an innovation hub. So we're calling it innovation.
Us what that is.
We're setting it up in Houston quarters, and it'll be, I would say, up and running in January. And it'll be a place where AI will, Tom and his AI crowd will work out of there and we'll work out of there. And it's a place where all the innovators can come. And I see it as, for me personally, I see it as somewhere that they can knock on the door, that they can get, because people are just, they don't know where to go. So to me, it's a facilitating place. We'd like to run hackathons. We'd like to do all these different things. But firstly, I think it is a place that will enable and support my innovators in the system, that they can come. And I'd like to run, different days out of there, different pieces. From Tom is slightly different. He has a different view on what he wants out of it. But I mean, it's a space for all of us to work from.
Well, I mean, if we go back to the point we were making, firstly, there's lots of projects going on that people don't know about and they're not learning from them. And then the other thing is that the innovators are nervous because they think it's going to be a black hole, I'll go nowhere. So if there's somewhere like an innovation lab where a bit like Dogpatch Lab, but for the private sector where you go, okay, that's where I go. Yeah. I understand how the game plays. I understand how I enter the system. And understand what the system needs by being involved.
Yeah. And I suppose at the moment I'm known as STIO, so they're like, what is that? what is the Sláintecare Transformation and Innovation Office? But if I had if actually it was the Innovation Hub, they'd know exactly where to go. So now at the moment, because we have a different title, they just don't know.
Yeah.
So it is a signpost, and it's a place where we'll be able to support and enable and collaborate. As because there's none really in the health service. There's one running in Tala. It's brilliant. It's fantastic.
What's it called?
It's the Innovation Hub in Tala. Literally, it's run by a lady called Natalie Cole. She's fantastic. She's part of the framework, setting up the framework, so one of the stakeholders. But really fantastic work, and they work very they have a huge co-design kind of department, and they work with academia. Academia come in. I was there the other week. They were running a hackathon on different IT, different tech problems. And it was just fantastic. Really, really great. So that's what I want our Innovation Hub to be.
Okay. And when you think about the possible barriers to getting where you want to go, and where you think about the possible, what it might look like when it works, what are you thinking? What comes into your head?
Yeah, I think the biggest challenge to overcome is for people it's about trust. I have to say, because we have huge, great stuff, great innovations going on, absolutely brilliant people in the system, but they just need to trust in the process and trust maybe in me a little bit. I'm not here. I'm here to help, support and guide. I'm not here for anything other than that.
Okay, so let's dream now for a little while.
Yeah.
It's 3 years from now.
Yeah.
What do you hope? What's the landscape? What impact will you have had?
That I won't have frustrated innovators out in the system. That I will have people who, if they're clinical, it doesn't matter what they are, whether they're clinical, non-clinical, a chef, a cleaner, whatever it is, and you have an idea to make your life easier at work or to make our patients' lives easier, that they can go somewhere, they can pick up a phone, they know where to go, and someone will help them. Because at the moment they have to navigate a system that is really difficult, and and you would actually give up at the first hurdle, to be fair.
Well, on behalf of the technology community, fantastic. Delighted to see that this is happening because there's so many opportunities. And on the other side, for us patients, right? Even better, because we'll get to benefit from all of this. And your frustrated doctors who are or clinicians that have come up with ideas. So it's great. It's a win-win. We wish you the best. We want you to come back and tell us how you get on. Okay? We want to hear more. And very good luck with the Innovation Hub as well for the AI.
Thank you.
And we look forward to finding out what's going on.
Thank you very much.
Lovely to have you.
Thank you.
So look, before I go, I'm just going to say thank you to the team in the studio. That's Peter Rice, studio manager, and I have Neil Horner, who's the video editor, and Lee Brennan and Richard Ryan, who are both sound engineer and videographer. And thank you very much. We look forward to seeing you again on Transform Gov at the next episode.